The meeting of the Public Safety Committee is now called to order. Mr. Clerk, would you please call the roll?
Alderman Bosley. Alderman French. Present. Alderman Vaquero. Alderman Cohn.
Present.
Alderman Carter. Alderman Coter.
Here.
Alderwoman Spencer.
Present.
Alderwoman Green.
Present.
Chairman Kennedy.
Here.
We have 6 present and we have a quorum.
Thank you, Mr. Clerk. We have 2 items before the committee, Resolution 218 and Board Bill 292. We will not be hearing Resolution 218 today based upon the request of the sponsor, but we'll be scheduling another hearing for that one. We will have the sponsor of Board Bill 292 discuss her bill today and give the committee opportunities to ask any questions. I do understand you have a few specific guests that you have that want to also give him more information about the bill and its construction and the rest. We do see, and I had received some emails from a number of individuals who were interested in testifying on the bill today. Our meeting today is not a public hearing in that we'll take testimony. There will be another meeting scheduled specifically for that testimony. We will not be passing the bill out today. Our primary goal today is to hear the testimony from the sponsor and have questions answered from any of the members of the committee today. And then we'll have the public testimony on it at a later time. We do both welcome anyone who is not usually in City Hall into the meeting today. We also welcome public testimony. It's just today we're not having that portion of the review of the bill. We both welcome you here and thank you for demonstrating both your interest and concern about the legislation of the city and the workings of city government. We do thank you. There will be, you can follow this up on the city website or even call your alderperson to see when the next hearing will be for this. We haven't scheduled it yet, but the idea of the next one on this bill would be for public testimony directly. Okay? So again, we both welcome you and thank you for being here today. With that, we will listen to the sponsor of the bill, Alderwoman Ingrassia.
Thank you, Mr. Chairman, members of the committee. I appreciate your time on this issue today. I've been involved over the past year, but more specifically with more specific concerns over the past couple of months with NARAL, Missouri, and Planned Parenthood with respect to an increase in troubling and intimidating behavior being seen subsequent to deceptive video and altered video from the Center for Medical Progress and a shooting in Colorado Springs Planned Parenthood with respect to demonstrations outside of Planned Parenthood on Forest Park Parkway. I've worked closely with the City Councilor's Office, our clerk, and attorneys for NARAL, Missouri, their national Planned Parenthood national attorneys as well, to really try and determine how best to address the issues that are arising with respect to safety of their clients at Planned Parenthood who are coming in and out of the driveway there. Keeping in mind at the forefront the delicate balance between patient safety and privacy and First Amendment rights that we should make sure that we're upholding. With that being said, there is a way to create a smart balance to allow demonstrators to be at that spot for what they believe is their right and what they would like to be communicating to the folks who are coming in and out of there, while also making sure patients feel safe. The City of St. Louis does have an impeding the flow of traffic ordinance that was originally being used to try and stop the demonstrators from reaching the cars directly or pedestrians directly that were coming in and out of the driveway. It was tweaked a number of years ago specifically to address the issue at the Planned Parenthood on Forest Park Parkway, but is unfortunately still not really working well with respect to law enforcement and what they believe they're able to move forward on. And so this bill would create a buffer zone. What you have in front of you today is going to change for the next committee hearing based on some additional conversations we've had in looking at First Amendment issues in the 8th Circuit and also across the country. So it would create an 8-foot buffer zone just around the driveway itself. And so today I have representatives from NARAL, Missouri, Planned Parenthood, the police department, and the city councilor's office, who I would like to have testify with respect to the need and how we think this change in our ordinances will help solve the situation. Okay. So I'd like to call first Allison Dreeth with NARAL, Missouri.
Point of order, Mr. Chairman. You just stated for the record.
Pardon me, but you do not have the opportunity to speak. Please have a seat.
You just stated for the record.
Please
it
have a
wasn't public
seat.
hearing.
I've asked you to have a seat.
Point of orders from the audience.
Ma'am, could you speak up because we don't hear well over here?
Yes, I can do that. Good morning, alderpersons, and thank you for allowing me the opportunity to share my story in support of Board Bill 292 this morning. My name's Allison Dreeth, and I'm the Executive Director at NARAL Pro-Choice Missouri, a statewide grassroots organization with more than 50,000 members, over 8,000 of which live right here in the city of St. Louis. We urge you to support this piece of policy submitted on behalf of Alderwoman Ingrassia. Imagine going to work being greeted with angry men and women screaming, "Dr. Death, murderer," hearing vague references to how maybe someone could kill you because you kill babies, being told by your neighbors that there were people walking around your neighborhood today distributing flyers with your picture under the words, "Killer Among Us." Imagine feeling like you must have a remote start mechanism on your car because you're afraid that someone at some point will put an explosive in it and you want to be able to start it from far enough away so you won't get hurt. Or imagine that you're going to your doctor's office for a medical procedure. To get to the parking lot, you have to drive through a gauntlet of people gathering in the driveway, trying to shove flyers in your windows, yelling at you that you're making the wrong decision, telling you that you will go to hell or that you're a whore or a murderer. I believe it is the right to free speech. It is one of our core values as American citizens, and I am proud to live in a country where the voices of our opposition are not quashed. But the behaviors that this ordinance will prohibit are not speech. Opponents of this ordinance argue that this will impact the right to protest outside of reproductive health care facilities. Nothing could be further from the truth. Behavior like this will be complementally legal in St. Louis after the ordinance is effected. What will be illegal is behavior like harassment, intimidation, blocking clinics, following patients and staff. This is what the ordinance prohibits. The people speaking out against this ordinance today are not speaking out to protect the right of free speech. That is already protected. The people speaking out against this ordinance are here defending their right to harass and intimidate. That is not acceptable behavior in our civilized society, and that should never be defended. We will never be able to stop every act of violence or make everyone behave civilly, but this ordinance is a way to take a situation that has escalated towards violence and stop the escalation before it takes a violent turn. When peaceful protesters and prayer turn into harassment and intimidation, it only takes one more step to turn into violence. The vandalism at Planned Parenthood Clinic on Grand Avenue was just broken windows. Just like the bomb threat at Planned Parenthood on Forest Park Avenue, it was a threat. A threat that our city police department took seriously, but we need to make sure our police officers have not only the tools they need to de-escalate a situation, and that this is exactly what this ordinance would do. NARAL Pro-Choice Missouri has run the clinic escort program for over 30 years, and I have with me today clinic escort reports from the last 11 years, collecting data on clinic harassment, intimidation, and assaults. In 2016 alone, 2 of our escorts were assaulted. One of those incidents, which happened in November, is currently in court. This ordinance is a balance between our constitutionally protected right of free speech and protest and our government's responsibility to protect the health and safety of its citizens. It passes the constitutional muster and in fact is modeled after a buffer zone ordinance currently being enforced in Columbus, Ohio, Pittsburgh, Pennsylvania, Spokane, Washington, Colorado, Massachusetts, and New York City. In fact, the New York City policy was mentioned by the U.S. Supreme Court as a model way to enact such an ordinance when the Supreme Court struck down the first Massachusetts 30-foot buffer zone. This ordinance is constitutional. This ordinance is needed. This ordinance is the right thing for our city and for all of our citizens. With one remaining abortion clinic left in our entire state for over 3 million women, if a threat like the one that was just made at Planned Parenthood earlier in January were to happen, it would happen here in our city, and it would be a stain on all of us. We urge swift passage of this bill.
Please sponsor. Did you have- Let's take them all and then ask questions. Thank you.
I'd like to invite Angie Postal with Planned Parenthood.
No point of order. There is no point of order from people in the audience. I did explain how we're going to, I did explain, and I thought very clearly how we would operate today. Now, if you wish to speak to us, you can speak after the hearing to one of the individual alder people. If you continue this way, I will ask you to leave. Alderwoman.
Rich, it just appears that there's testimony in favor, but not.
I've asked you to be quiet.
My name's Angie Postal. I'm the Director of Public Policy for Planned Parenthood of the St. Louis region in Southwest Missouri. Thank you for hearing my testimony this morning. At Planned Parenthood of the St. Louis region in Southwest Missouri, we serve 45,000 patients each year. Over 90% of those visits are preventive care visits. We do provide the full range of reproductive health care, preventive care including contraceptive services, sexually transmitted disease testing and treatment, well woman and well man care, sex education, and the full range of contraceptive services such as medication abortion or medication contraceptives and contraceptive devices. We also provide reproductive health services on Forest Park Avenue, abortion care at the state's only licensed abortion provider. We're here to go on record in support of Board Bill 292 because we want to protect the safety and privacy of our patients, visitors, and staff while also honoring the free speech rights of those who protest us. We believe this bill strikes that balance well, and we urge this committee to pass it. Thank you.
We need the sponsor.
I'd like to call Major John Hayden with the St. Louis Metropolitan Police Department.
Good morning, committee members. I'm here to give, on behalf of the police department, a preference for supporting the bill. I was the commander of District 5 up until October 2015, and then now I'm the commander of North Patrol Division, and I've been present, while working various confrontations that happened at the gate, and I understand this bill to create a buffer zone that 8 feet or so on either side of the gate. It would be very helpful for us to keep peace at the gate. Quite often the confrontations happen at the gate, and so any kind of demarcation that would be near the gate that would allow people to express their First Amendment rights, but at the same time keep a marked zone. It would certainly make our jobs easier. And I think I'm also speaking to times when we're not there as well. Like I said, a lot of times the calls come when police aren't available readily to respond. I think it would certainly cut down on the amount of confrontation that occurs at the gate. I think it would be very helpful if we had something like that. Yes, calls for service in 2015, there were 38, in 2016, there were 66, and so calls for service are increasing. We are expecting a pretty significant protest, in fact, this Saturday. And so we know by social media that a lot of people are interested in coming there. And, I don't know how soon you can get it, but certainly we're expecting the fact that there'll be some confrontation there this Saturday.
Did you have any others?
Lastly, Mike Garvin from the City Councilor's Office.
Okay.
Good morning. The bill you have in front of you was patterned after a similar Colorado ordinance that was affirmed by the United States Supreme Court. We've been working to improve on it and actually simplify it, which I believe will benefit not only the goals that we're trying to accomplish with the ordinance, but also the protesters, the demonstrators who appear there. They'll be very clear on what you can do and cannot do. I believe it will preserve their rights to demonstrate, while it will allow people to enter and exit safely and avoid confrontations. That's what we're working on now, the amendments that were referenced earlier. But either way, I think the bill will withstand any sort of legal challenge. I feel comfortable with that.
Alderwoman, did you have any?
I'm happy to take questions, or
Okay.
the members of the, who spoke are happy to answer questions as well.
We'll begin with questioning. Alderman French?
Okay, so I am a supporter of the work that Planned Parenthood does, has been vocal about that. But as I have mentioned to you before, I have some big concerns about First Amendment rights being limited in any way. And so especially in Section 1. Section 1, Part B, where it says that no person shall knowingly approach another person within 15 feet of such person unless the other person consents for the purpose of passing a leaflet or handbill, displaying a sign, and engaging in oral protest, education, or counseling with such other person in the public way or sidewalk area within a radius of 8 feet from any part of the entrance to a health facility. That seems to be a big limitation on First Amendment rights. And it seems to me a slippery slope that if we allow such a limitation for Planned Parenthood, that then such a limitation could be requested so at police stations or at other places that are of controversy. So it is very difficult for me to, especially considering a lot of my work in the last few years, to limit protest.
Sure, and I think that's a very valid concern. Unfortunately, we decided not to take up the amendments today, but that language with the amendments is actually struck out, and there's some new language with respect to, I believe it's Santa Barbara, California, that changes that a bit. I will say this was language that was pulled from the Colorado decision that the Supreme Court of the United States upheld, which is why we originally went with it. But I think it is a concern, and as I mentioned earlier, we spent a significant amount of time trying to ensure that we were protecting demonstrators' right, but balancing it with a woman's right to access legal health care safely and privately.
Sure, and specifically on the subject of safety, obviously when someone touches another person or physically assaults them, that is a violation of existing law. That is beyond protest, that then becomes an assault. And obviously those people should be dealt with and prosecuted to the fullest extent of the law. But language like limiting oral protest, that seems to me un-American.
And again, yes, this language is going to change, and I do think that your point with respect to First Amendment rights is valid, and it's at the forefront of what we are attempting to do here.
Okay. Well, I'll look forward to the amendments. Thanks.
Alderman Cone?
I'm just curious, and I texted him, but I haven't heard back yet, but has the ACLU been involved with the deliberations here? And is there a representative from the ACLU in the audience?
They have been involved in conversations, and they've chosen to remain neutral.
Okay. And I mean, you know the history as well as I do, but you know, I've been involved with conversations with Planned Parenthood and the ACLU and the City Councilor's office for a number of years in regards to this, and the ACLU has not necessarily been the friendliest when it comes to this particular topic because of their concerns around First Amendment rights. So I would be curious to have a conversation with them about it, just to get their perspective on the bill and make sure, you know, from a legal perspective, you know, that there isn't going to be any challenges from them in particular. I'm sure that, you know, there will be, you know, detractors, you know, from this bill, but anyways, I obviously support the work that Planned Parenthood does. I've served on their board for a number of years. I think there's a lot of misinformation out there in terms of what they do. I appreciate Angie and Allison coming down to testify to share that perspective, but definitely want to make sure that we're taking into consideration the civil liberties of everyone as well.
I couldn't agree more, and I would encourage you to reach out to the ACLU directly.
Yeah, I just did. I sent them a text
Okay.
message while
Yeah,
they were testifying.
at this point in time, they're not coming out for or against.
Okay.
That complete you?
Yeah, I'm finished with my questions for now.
Alderman Coulter?
Thank you, Mr. Chairman. These questions are probably more from Major Hayden. He gave us a couple of stats, I believe, in his remarks regarding calls for service. I believe he said there were 38 calls for service in 2015 and 66 in 2016. Did I write those down right?
Yes, sir, that is correct.
Okay. Could you also speak to, or if you don't know these offhand, provide the committee, could you give us some, I guess, comparisons, buildings in that vicinity? What do we have in terms of calls for service for other nearby structures or buildings?
Okay, I guess catty-corner to that, I believe it's that Cortex building, so those are commercial properties.
Yeah.
So the buildings in and around that intersection are very, very limited call for service. It's pretty much business-related type things.
So would you consider the 66 calls for service in 2016 to be a high number?
Yes, because that would be a little bit more than one a day. I mean, to come to the same place and kind of deal with some of the same concerns all the time takes its toll on calls for service and availability to go to other calls for service.
Okay. Now, just to clarify, you said that would be one a day. Could you?
Well, I mean, I'm saying 66 is, I'm sorry. Math-wise,
couple a month?
Yeah, it would be at least a
Okay.
little over one a week, I'm sorry.
One a week. All right, yeah, that makes more sense. All right. How about arrests? Do you have any stats for us based on arrests, whether for peace disturbance or other charges in and around the Planned Parenthood building?
Right. I actually don't have statistics, but arrests generally are fairly limited.
Okay.
Simply because, once we are able to restore peace, people will 9 times out of 10 comply with what we're asking them to do.
Okay.
But the confrontation itself sometimes takes, maybe 15 or 20 minutes to get some people to comply.
All right. How about summonses? Do you have any summonses, or is that sort of the same line of
It would be the
arrests?
same line, because I don't have statistics for the summonses, but it would be rare that we actually issue a summons, like I said, because most of the time, once our presence is there and once we ask people what we're trying to accomplish, most of the time, people will be in compliance.
Okay. And Major, in your experience as a police major with the police department, how many years have you been with the St. Louis Police Department?
It'll be 30 years completed in a couple of weeks.
Okay, and I know you were a captain before you were major, correct?
Correct.
And was that in the district that
Yes.
that contained the
I was
Planned
the
Parenthood
captain
facility?
of the district that contains.
What's that, the 5th district?
That's correct, yes, sir.
Okay. So, in your experience as a police captain and now a police major, when a car, whether it's a one-man or two-person, one woman or man or two-person police car, have to respond to these calls for service, approximately, on average, how long is that car then out of service dealing with the call?
If it can be brought to, some resolution without arresting somebody, normally 15 or so minutes.
So 15 or so minutes to respond to and address these calls?
Yes, sir. Sometimes we get called back, but for the most part, a disturbance can be 15 to 20 minutes.
Okay, and would this be generally a circumstance, a call for service to the Planned Parenthood, the outside of the Planned Parenthood facility? Would that be would you send one car or two cars?
That would be a two-man assignment.
Two-man
A
assignment.
minimum of two-man assignment because of the confrontation that's involved.
So we're talking two cars spending approximately 15 minutes dealing with whatever situation is happening, approximately 66 times a year last year.
Probably on average, yes, sir. I think that's fair.
Okay, thank you, Major.
Do you mind if I add to that?
Surely.
So Alderman Coder, based on conversations that I've had with Captain Eric Larson, who is the assigned captain to the 5th District now, and some of the bike patrol officers who are responsible for that area, while one or two cars may be in service for 15 to 20 minutes a time, part of the issue is that why there are not more arrests or summons issued is because they will play back video. So that takes in and of itself time to contact Planned Parenthood and get in and be able to have access to that video. And because there is no bright line right now, it's very difficult for them to tell what actually happened on the ground. And unfortunately, we do not have the manpower in the police department to have an officer stationed there all the time.
Thank you.
Alderwoman Spencer?
Thank you, Mr. Chairman. I had a couple of additional questions for the Major along the same lines.
Yes, ma'am.
Thank you, Major. In addition to responding to calls for service, you mentioned that you're anticipating some action this weekend, and you had done some online, by viewing what's going on online. In addition to these responses, does the police department actively patrol to kind of make sure that there are no problems? Is the police department proactive in ensuring the safety of both the protesters and folks using the facility?
Yes, ma'am. It's just that, but for the example for the event this weekend, we'll actually have to have a detail for that. That's going to be something that, what I understand to be, at least a few thousand people in and around that location.
And then the city of St. Louis is paying for that, am I right?
Yes, ma'am.
And so the idea would be to provide safety for everybody involved.
Absolutely.
And so the police department, is this something the police department is regularly participating in at this particular facility?
We don't often have to have a detail at that location, but naturally, I think that's 522 area, so our patrol car pays close attention to the area, but when we have online information that indicates that it'll be a flood of people at that location, we'll have to do something special. And in this case, because there's thousands expected, we're actually putting together a detail.
Would you consider a non-insignificant amount of police resources are deployed to this facility on a somewhat regular basis?
I would say on a regular, just talking. Yeah, I would say on a regular basis there. I know that there's going to be calls for service there. It's certainly very common for it to be calls for service at that location.
Okay, I appreciate that. That's the questions I have for you.
Yes, ma'am.
The sponsor of the bill, we mentioned the city councilor, Councilor Garvin mentioned that this was modeled after some Colorado legislation. I assume, could you speak to precedent in other cities for similar buffer legislation?
I will answer that broadly because I am going to be bringing amendments back at the next meeting this week. But the Colorado law contained something called a bubble zone and then a static buffer zone, and that was upheld by the Supreme Court. Now, what we're looking at doing, because I think it's more helpful and more narrowly tailored to the needs that we have in St. Louis City, is a static bright line buffer zone that does not include the bubble around the pedestrian or car. That gets confusing and is not going to be necessarily helpful to law enforcement. So Englewood, New Jersey, and Santa Barbara, California have similar laws to what we're looking at now. But the landscape is difficult. That's why we've spent so much time trying to talk to attorneys and policymakers with respect to how best to word this to have it withstand a court challenge.
Okay, so in a very simplified manner, what we're looking to do, Section 1 has 3 provisions, one being the definition of the healthcare facility. The first provision would be preventing the prevention of a person knowingly obstructing somebody coming into a healthcare facility. And then the second one would be sort of the bubble that you speak of?
We are not going to, we decided that that was not something that we need in St. Louis. It would not be helpful. The Supreme Court has said in a multitude of decisions that if we narrowly tailor to our specific needs, we'll be better off withstanding a court challenge. So the decision was made to change that language. So that's why I said I would speak about it broadly, but I believe we're having another hearing on Thursday morning where I will introduce amendments that change this a bit that I can speak to at that point.
Okay, but we don't have those provisions before us today?
Right. The chairman decided that we would take that up on Thursday.
Okay. Without the specifics, I have no further questions at this time.
Alderwoman Green?
Thank you, Alderwoman Ingrassia, for bringing this forward. As you know, I'm supportive of this. I've shared the concerns of the alderman from the 21st as somebody who's been very active in a number of protest movements. It's obviously very important to me that we uphold First Amendment rights. I also think that First Amendment does not, and I believe the Supreme Court agrees with this, does not extend to threats of intimidation and harassment. And personally, I have seen that happen at the Planned Parenthood clinic. And one of the things I guess questions I have is regarding dealing with impersonating clinic staff. So one of the issues that I saw going into Planned Parenthood was when I was driving into the entryway, there was a large sign that said check in here. And so I stopped there only to find that the place that I was checking in with, the people that I was checking in with, were not Planned Parenthood staff. They were protesters disguised as Planned Parenthood staff. So how would this impact that and I guess stop that misrepresentation from happening?
That's a great question. And I think one of the major concerns we have with respect to pushing the demonstrators back a little bit to allow free access in and out of the driveway there at Planned Parenthood. If the demonstrators are 8 feet back, they will not be able to be right where the car is pulling in and out. Yes, and there are, aside from just the check-in here, a lot of times the demonstrators will wear vests that look like they're supposed to be guiding traffic, which is obviously very deceptive.
Okay. I think the other question I have is, I talked with the nurses union last night. Would you be able to reiterate just some of their concerns and how this will not impact the ability of unions to organize at healthcare facilities?
That's language that will be within the amendments as well.
Okay.
There are a couple of issues. One is the suggestion had been made that we specifically tailor this to reproductive health care facilities and not healthcare facilities generally. Content neutrality is something that the Supreme Court looks at. So if we tailor it too narrowly to focus on just one obvious type of protest, that would likely not withstand a court challenge. So we're trying to balance the specific needs of Planned Parenthood with making sure that we're not stopping somebody else from undertaking union organizing or something like that. So those conversations are ongoing, and I was grateful that they were brought to my attention.
Okay. I think no further questions at this time.
Alderman Cone?
We did have, at one point in time when Alderwoman Young was the chair of the committee, I believe there was a board bill that was before us, because at the time there were, protests that were taking place in front of, Bank of America with the foreclosure crisis that was happening, and Peabody Energy with the, coal workers and miners and their pension issues. And so, that was a concern at the time as well, was, how do you balance the public safety with the rights of folks to demonstrate at the same time? And so, I appreciate that you're taking that into consideration, and also that we're applying it equally across the board for all protesters and not just some of them. And especially as it pertains to healthcare facilities. I know, there's probably a few in the audience that believe that Planned Parenthood does nothing but abortions, but they actually do provide quite a bit of health services. I've used them myself for STI screenings and things of that nature. But, I do believe that, from a legal perspective, maintaining that, level of neutrality, and particularly a level of public safety for entrances into healthcare facilities, whether it's Planned Parenthood or BJC, a healthcare provider or a protester or a unionist, that's striking, at the end of the day, it's a healthcare facility and we need to maintain, access to it.
Right.
So.
Something that I didn't realize until recently as well is that our courts and schools and healthcare facilities, there is already a quiet zone ordinance that's in effect. Yeah, so it's an issue that I think people have been thinking about for a while. But yeah, content neutrality, First Amendment rights, and definitely trying to ensure that what we're doing is protecting the safety of women who are accessing healthcare at Planned Parenthood are at the forefront of the conversation.
Alderman Spencer?
Thank you, Mr. Chairman. I did have one additional question for the sponsor. So the intent of the board bill, the ordinance here would be to create a bit of a buffer zone. Am I right? Does this bill in any way prohibit people from gathering and praying or protesting at any site?
No, it does not.
Okay, thank you.
Okay. Then what the bill does is require this 8-foot buffer. Is that what I understand correctly?
Just around the driveway
Just around the
entrance
driveway.
to Planned Parenthood on Forest Park Parkway. Well, it would not,
Not specifically for the.
right, 8 feet around a driveway, but that's the language that will be included in the amendments with specificity. What's listed in the original board bill is a little bit different.
Are there any other questions from members of the committee? Do you have any other words you'd like to say on it at this point?
No, thank you for the time today and look forward to continuing the conversation at the next hearing.
Okay, then. All right, that completes our agenda for today. As I said, we will be scheduling another meeting for the public testimony part of this, and that will be on the city's website on the exact date. This committee just was assigned this bill last Friday, and so we called this meeting here today. We have a number of other bills in the coffers of the committee that are also supposed to be heard that also require public testimony, and a number of people who want to testify with that. Now, you know me as a chair, I do not like to combine all of that into one meeting where you have these major testimonies and we're there for 5 and 6 hours on the bills because it gets to be taxing and tiring on the public as well. So we're going to try our best to schedule what we can to make sure that all these bills have their opportunity. But we're here at the last moments of the entire legislative session. Friday is the last day before this board goes on break. So I'm saying this specifically for the committee that gives you an understanding of what we're going to try to do. I can't guarantee we're going to make it all by the end of this session, in particular, saying that we just got this bill on Friday, but we're going to do our best. Okay? All right, since there's no other items on the agenda, with that, we thank everyone for coming out. Please pay attention to the website. Our meeting is now adjourned.